In the pediatric ward of a national referral hospital in a low and middle income country, one child will receive care that another child will not due to disease specific donor funding. The reality on the ground is an inequity in care between two children, both gravely ill and not even 2 feet apart. Our company, Guildata, is seeking to address this inequity, and Guildata's value proposition is to provide customers with data that shows them the greatest return on investment by reduction in morbidity and mortality for public health interventions and a non-disease centric approach. Within the healthcare industry, there already exists a copious amount of free, peer-reviewed public health articles and databases such as PubMed, which can inform appropriate funding strategies. However, as stated by Dr. Edward Kroger, if you're trying to keep up with every medical article written and published in the world, you'd have to be reading 90 articles every 24 hours, 7 days a week throughout the year. The consequence is that there's a tremendous amount of data that is not being evaluated and comparatively analyzed against other articles to inform decisions within healthcare. However, Guildata is the first venture of its kind because we're building a public health data platform that evaluates millions of these peer-reviewed articles on public health interventions to enable systematic comparisons and guide global health spending strategies. We're excited for how this data will address the inequity in global health aid funding, which was a market that received $55 billion in 2020. In fact, every year billions of dollars are provided in health aid, but the process for funding allocation has been described as often opaque and difficult to understand. The central question remains of how do you decide where the money should go? And at Guildata, we are excited to finally be able to provide an answer to this question.